Hello, viewers.
Good morning. This speaking test is arranged by Emmet Academia. As this is a mock test, we won't require any ID. This is your cue card and you will be having 3 minutes for preparation. Your 3 minutes starts now.
Hi, good morning. I am Emmet, one of the registered nurse of this department. How may I help you today?
I was bitten by a dog in my hand.
So sorry to hear that. Try not to be worried at all. Before proceeding, could you please tell me your name and age for the record purpose?
My name is Robert, and I'm 30 years old.
Okay, Robert, can you please explain me in detail about the incident?
I was bitten by a dog an hour ago, by my neighbor's dog. It broke my skin in several places, and I think the wound is deep. It was bleeding heavily.
Okay, thank you for briefing Robert. Well, could you please tell me what first aid have you done to your wound?
Nurse, I didn't try to clean my wound as it was bleeding heavily. I just covered it with a sterile pad and applied some pressure on it. I haven't used any cream apart from that. I took 2 paracetamol tablets, but it's still painful.
Please relax, Robert. Try not to be worried. We will proceed with the treatment soon. Now I'll explain you the next step. Initially, I'll clean the wound so that assessing the wound will become easier. Then doctor will examine your wound. Once he examined the wound, he will ask you to do the blood test to rule out in case of any infection. And finally, he will prescribe appropriate antibiotics and pain relief medications. As you said before, the severity of bleeding, doctor will recommend you for an x-ray to check for bone, tendon damage. Also, I would like to advise you to take a tetanus booster. Robert, may I know when was the last time you took the tetanus vaccine?
I can't remember, nurse.
No worries, Robert. You can take it now.
Could you please tell me how many stitches I may need?
Well, Robert, your question is reasonable. According to the current recommendation, stitches are not prescribed for animal bites. It is because it makes it easier to clean the wound and it reduces the risk of infection. Along with that, it is advised to have a review appointment after a few days. Are you following me, Robert?
Yes, nurse.
Okay, now doctor will examine your wound and prescribe the appropriate treatment. Robert, do you have any concern?
No, nurse, you cleared a lot.
Before concluding, let me summarize what we discussed so far. You are here to receive treatment as you were bitten by a dog, and then you explain the severity of the dog bite. Furthermore, I asked you about the previously received treatment, if any, for the dog bite. Next, I explained to you about the cleaning and assessment of the wound by the doctor, and also suggested you to receive a tetanus booster. Lastly, I informed about the current recommendation for animal bites, that is, no stitches are needed for animal bites. Am I correct, Robert?
Yes, nurse.
I hope I had cleared all your concerns. Thank you, Robert. Do follow all the instructions. I wish you a speedy recovery.
This is the end of the speaking test. Thank you for watching.